For the longest time, I knew I wanted to be a doctor, but I wasn't really sure what type of doctor. But when I was a teenager, actually, both my parents became ill with cancer pretty much simultaneously. And I was older. I was the oldest of the kids, and that has a pretty formative. It was a pretty formative experience to have that situation, being thrust into that situation. So since then, it kind of tilted me towards oncology, and then once I really started doing the rotations and seeing and taking care of folks who had cancer, I could relate to it on such a personal level that I knew that it's where I wanted to be, because whenever someone comes into the office and I see someone, I tell them you're become part of my family now. And I genuinely feel that, because I've been there since I've been a kid. I understand what it's like to be on the family side of things and also on the doctor side of things, and it just allows me to relate and understand and help people that much better.
I first heard about Dr. Fink from my OB. She was actually a patient of his, and I was pregnant and I was needing treatment for ITP, and she recommended Dr. Fink. So she recommended him with the highest level of recommendation. So I was excited to meet him. And then when I first met him, immediately I loved him. He was so caring and gentle, but really knowledgeable. Dr. Fink is just a phenomenal person and doctor, both. Dr. Fink helped me decide my treatment. He presented all of the options, and basically we went through each one and decided which would be best for me in my situation. And I am so glad that we chose the route we did, because it worked. He knew my level of knowledge, and he was able to understand what I was thinking, and he would put it all into perspective for me at my level. And then if I had any questions, he absolutely had, answers. The nurses in the treatment room are so compassionate, and every time you come for treatment, they treat you exactly the same way. Even though, you were there the day before, or you're gonna be there for a week, they never forget that you're not feeling well, and they take such good care of you and make every single patient comfortable. And that's one thing that I loved, that you knew that when you came, I knew that when I came, I would be comfortable, and they do everything that they can to make it a good experience. I love them.
That's one of the best days, when you're finishing up chemotherapy with someone and you say, "You're all done, get on out of here. You look too good to be in my office." They're always coming and following up with us, but it's a great day to say, now you've finished this, go on with your life again. We don't live life to get treatment, we get treatment to live life, and that's an important thing that we do in Florida Cancer Specialists.